I and more than 60 other refugees have been imprisoned for 7 years by the Australian government. We were transferred to Australia for medical help on the medevac bill 9 months ago. We locked up at the Mantra Hotel on the third floor. Every 24 hours there are around 60 staff changes. It is impossible to practice social distancing. This puts us at the high risk catching COVID-19. I asked the government, what are you going to do to make sure COVID-19 cannot spread to us and into the community? This is an urgent public health issue. Why can't you release us into the community so we stay with our families, friends, and be safe?
Jodie McVernon, I just want to understand precisely from you, are these individuals that are being held in a hotel in Melbourne a public health risk in the scenario that they're in? There's 60 of them, 2 to 3 to a room. Some of them have been here up to 9 months. Farhad says he's been waiting for medical treatment. They're being kept in their rooms, he says, for up to 23 hours a day. And he hasn't seen fresh air in 4 weeks since the COVID-19 restrictions have been put in place.
So clearly this is a really complex and difficult situation, and I really feel for all of these people. In terms of the risk that is posed to them, obviously people working in the hospitality industry have very clear guidelines in the hotel industry about how to maintain safe distancing practices, how to clean properly, how to take those appropriate hygiene measures, and in the same way that we're quarantining Australians returning from overseas in hotels on arrival. So in that particular environment, there will be measures put in place to reduce the risk of transmission of infection. But the wider issue of people in detention is a very difficult one, and in all of those environments it's important to try to mitigate risk as far as possible. Simon Longstaff.
Well, I think, although we might disagree in the panel about the means that might be employed, what we're all saying is we're wanting to privilege the value of a human life. We just have difference about how best to do that. In this case, you have to also add in the factor that anybody who seeks asylum, the one obligation that you've got as a country when somebody seeks asylum is to offer them safety. And if you put people into a situation where you have reason to believe that they are unsafe because of the nature in which you're holding them, you're breaching the most fundamental obligation.
Well, these guys, I say, this is effectively an airport hotel, and there's flight crews coming in and out of there all the time.
This is the point, that if you think that the actual circumstances in which they find themselves makes them unsafe, and their life obviously matters as much as any other person's life in a case like this, then you need to adjust the circumstances. So the government may wish to keep them in detention for reasons of policy and practice, but not in circumstances where they have a heightened risk of some kind of harm befalling them. And that's the conundrum that the government, I think, needs to balance, is how do you honour the obligation of safety, respect their lives as much as we would any other person, and if there are other considerations they need to, where they can't be released, solve that problem and show how that can be done.
Nev Power, what do you think should be done about these individuals?
Well, Hamish, it's a little hard to understand the specifics of the case, but it does sound, as Simon said, that they're being put in harm's way. And if that's the case, that needs to be investigated and the circumstances changed so that they are not being exposed to greater risk. I think we all know that the best protection against the spread of the coronavirus is to maintain physical distancing and good hand hygiene and those things. So people coming in and out of a hotel shouldn't pose a specific risk to them if that is maintained. But the particular circumstances, I think, needs to be looked into just to make sure what is actually happening there.